Hello coders! Today we're talking about the E codes and ICD-10, which is endocrine, nutritional, and metabolic diseases. We're going to start today by looking at ICD10data.com and looking at the different types of diabetes. We're going to talk about the different types of diabetes first, and then we're going to jump over to the guidelines. So these are our four different types of diabetes. So we have diabetes due to an underlying condition, drug or chemical induced diabetes mellitus, type 1 diabetes mellitus, type 2 diabetes mellitus, and others specified. So we go into each one of these. It tells us, so for E08, this is going to be due to some sort of disease or condition. So you can see here we have a code first for things like rubella, Cushing's syndrome, a malignant neoplasm. So this is going to be due to an underlying condition of some sort. So again, the doctor would have to describe that the diabetes is due to the malnutrition or the cystic fibrosis or the Cushing's syndrome for us to use E08. E09 is drug or chemical induced. And again, when we look underneath, it says code first poisoning due to drug or toxin if applicable, or adverse effect. So again, this is drug or chemical induced. So this could have been a treatment that someone had. This could be radiation. This could be an over-the-counter medication. Anything that's considered drug or chemical induced fits under E09. Now, type 1 diabetes mellitus includes all of these different terms. They'll call it brittle diabetes, due to autoimmune processes, due to pancreatic islet beta cell destruction, idiopathic, most commonly juvenile, or ketosis prone. So again, type 1 specifically, as it says right here in the clinical information, is an insulin deficiency. Okay, so basically what happens is usually in childhood or in teenage years, the pancreas basically stops being able to produce insulin. And so these are people that are going to have to replace the insulin that their body is not normally making. Now, for the due to underlying conditions and the drug or chemical induced, those patients might be on medication. They might be on injectable insulin, or they might be on diet and exercise, or a combination of the three. However, when it comes to type 1, all type 1 diabetics need injectable insulin. So that's something to keep in mind. It's because the pancreas in their body is not creating the insulin, so we have to replace it. Versus type 2 diabetes mellitus, is also known as insulin-resistant diabetes or diabetes NOS. And this is basically when the body produces insulin but can't absorb it properly. And so it's non-insulin responsive. And so what happens here is, again, we get high blood sugars because again, the body cannot use the insulin properly anymore. This is also known as adult onset diabetes. For type 2 diabetics, again, they can be controlled by diet and exercise, oral medication, injectable insulin, or a combination of any of those. The last category that we're going to see is E13. There is no E12. And E13, again, is things like diabetes due to genetic defects, post-pancreatectomy diabetes mellitus, so after we remove the pancreas from the body. And so, again, this is the other specified. So the most common you're going to see in the field are the type 1 and type 2s. Type 2s far outweigh the type 1s, and type 2 diabetes is one of the most common conditions in people over the age of 50 in the United States. The other one is hypertension, and you'll notice that a lot of people will have both. So, one thing I want to show you guys, and you might have noticed this as I was scrolling, there's use additional code notes at each and every one of these. So we have Z code to describe if they're taking insulin, if they're taking an oral anti-diabetic drug, or an oral hypoglycemic drug. In this case, it's the same code. So we need to know again, is it insulin or is it oral medication or is it both? So let's go to our guidelines and let's see what they say. So Chapter 4, Endocrine, Nutritional, and Metabolic Diseases, again, E00 to E89. So, as it tells us, the diabetes mellitus codes are combination codes that include the type of diabetes mellitus, the body system affected, and the complication affecting that body system. As many codes within a particular category are necessary to describe all the complications of the disease that may be used. They should be sequenced based on the reason for a particular encounter. Assign as many codes from categories E08 to E13 as needed to identify all of the associated conditions that that patient has. So again, we're going to see things like diabetes with a diabetic coma, diabetes with retinopathy. So these are the combo codes. So your book tells you, for the type of diabetes, the age of the patient is not the sole determining factor, although most type 1 diabetics develop the condition before reaching puberty. For this reason, type 1 diabetes mellitus is also referred to as juvenile diabetes. And again, a key word there is most. Now, this is what we do though. If the doctor just says diabetes or the patient just says diabetes, okay, so this is what we do. If the type of diabetes is not documented in the medical record, the default is an E11 point something, which is type 2 diabetes mellitus. So if the type of diabetes is not stated and we cannot find any other information and we have asked the doctor about it, we've asked the provider, then we have to use an E11 code for type 2 diabetes mellitus. So the go-to code, if we don't know the type of diabetes, is always type 2 because that is the most common. So again, as it goes on to tell us, so what are we using to keep the patient's body stable? If the documentation in a medical record does not indicate the type of diabetes, but does indicate the patient uses insulin, code E11 point something, type 2 diabetes mellitus should be assigned, okay? So again, even if they said insulin, so all type 1 diabetics, some type 2 diabetics, some secondary, some drug-induced, and some other diabetics also will take insulin, and some of all of those might also be on oral medication or both. So this is what we do. If the patient is taking a medication, we need to know which one it is. So an additional code should be assigned from category Z79 to identify the long-term current use of insulin or oral hypoglycemic drugs. If the patient is treated with both oral medications and insulin, only the code for long-term current use of insulin should be assigned. So the insulin, because it's injectable versus oral medication, that will always go. If the patient takes both, we just put the one for insulin. Okay, so Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 patient's blood sugar under control during an encounter. So if a patient shows up to their doctor's office, urgent care, emergency room, and we need to give them insulin, that is not the same as these codes. These Z codes, again, are long-term current use. And when it comes to insulin, it has to be an everyday use. If someone just has an insulin pen as an emergency, that is not the same as taking it every day. So we need to know from the provider what the patient is taking, and again, is it a daily use? Now, one of the big things that a lot of people are doing, both type 1, type 2, and other diabetics, are getting the insulin pump. So the insulin pump is basically an external machine that connects to a catheter that is surgically implanted into the abdominal cavity. And what happens is this mechanism that you can connect to your body, inside the mechanism, it has the insulin. And so depending on the machine, sometimes you type in your carbs, sometimes it does it automatically. So this is, instead of someone having to inject themselves once or more a day with insulin, it's a direct connection directly into their body. but it is a device. And when we have a device, we can have complications due to malfunction. So that's the next set of guidelines, okay? So it tells us an underdose of insulin due to an insulin pump failure should be assigned to a code from subcategory T85.6, mechanical complication of other specified internal and external prosthetic devices, implants, and grafts that specifies the type of pump malfunction as the principal or first listed code, because the first thing that happened is a mechanical complication. Then what happened next? T38.3x6, underdosing of insulin and oral hypoglycemic drugs. Then additional codes for the type of diabetes mellitus should also be associated with any complications due to the underdosing, okay? So again, in this case, if it's an underdose, you put the mechanical complication first, then the underdosing code, then the diabetes and anything that happened, whether it was nausea, vomiting, whatever it might be. Now we also have the overdoses. So the principal or first listed code for an encounter due to an insulin pump malfunction resulting in an overdose of insulin should also be T85.6, mechanical complication of other specified internal and external prosthetic grafts, implants, and devices, followed by code T38.3X1, poisoning by insulin and oral hypoglycemic drugs, accidental. So again, if it's an underdosing, we use an underdosing code. If it's an overdosing, we don't call it an overdose, we call it a poisoning, okay? And those we can get from our drug and chemical table. So the biggest thing, if they have a device, is there a complication that has happened with that device? So the first thing we need to know is their type of diabetes. Second thing we need to know, are there any complications with the diabetes or with their insulin pump if they have one? Now, it goes on to tell us, and we looked at these already, codes under categories E08, diabetes mellitus due to an underlying condition, E09, drug or chemical-induced diabetes mellitus, and E13, other specified diabetes mellitus, identify complications, manifestations associated with secondary diabetes mellitus. Secondary diabetes is always caused by another condition or event, such as cystic fibrosis, malignant neoplasm of the pancreas, pancreatectomy, or an adverse effect of drug or poisoning. And that goes for the entire book. So if it's a secondary condition, it's because it was caused by another condition. So secondary diabetes mellitus is being caused by another condition. Now that condition could have been a poisoning to the body, or it could be a condition such as cystic fibrosis, or it could be a removal of such as the post-pancreatectomy. So it goes on to tell us, just like we saw for type 1 and type 2 diabetes, for patients with secondary diabetes mellitus who routinely use insulin or oral hypoglycemic drugs, an additional code from category C79 should be assigned to identify the long-term current use of insulin or oral hypoglycemic drugs. If the patient is treated with both oral medications and insulin, only the code for the long-term current use of insulin should be assigned. And again, we have to think about that for a second. If you have to inject something into your body, that is much more severe than taking an oral medication. And so again, remember that when we're talking about sequencing, a lot of times we want to think about severity. What's more severe? So again, if they take both, we only code for the insulin. Now, it goes on to tell us, again, if a secondary diabetic patient comes in with an issue, code Z79.4 should not be assigned if insulin is given temporarily to bring the type 2 patient's blood sugar under control during an encounter. So again, if we're just giving the patient insulin for one situation and they don't take it every day, we can't code for it. Now, the sequencing of the secondary diabetes codes in relationship to the codes for the causes of diabetes is based on the tabular list instructions for categories E08, E09, E13. So remember, we're always going to look up the diabetes in the alphabetic index, cross-check it in the tabular, and at the beginning of the code categories, it is going to tell us, use additional code first. What do we need to do? The other big thing that a lot of people forget about is the removal of the pancreas. So for post-pancreatectomy diabetes mellitus or lack of insulin due to the surgical removal of all or part of the pancreas, assign code E89.1 post-procedural hypoinsulinemia. Then assign a code from category E13 and a code from subcategory Z90.41, acquired absence of a pancreas, as an additional code. So remember, this is a little more complicated because we've done a couple things here. The first thing is because we've removed the pancreas, they're going to have a post-procedural complication, which is E89.1, the hypoinsulinemia. Okay. Then we have to assign a code for the type of diabetes. Okay. Then we need to remember to put on the acquired absence that we went in and removed the pancreas from this patient's body versus that they were born without a pancreas. So again, we have to keep that in mind, that Z9041 is important. Now again, it goes on to let us know, secondary diabetes may be caused by an adverse effect of correctly administered medications, poisonings, or sequelae of poisoning. So again, they're just giving us some more information about that E13 category. So I want to go back to the ICD-10 data again. Okay, so when we look under E10, okay, so oops, sorry, I'm on the wrong one, E10. So when we go down, again, we're going to see the type 1, and again, we have with ketoacidosis, without coma, with coma. And again, diabetes mellitus with kidney complications. So again, we have to look and we have to be careful. Do we need another code to better describe what's going on? A lot of these are combo codes, so we don't need to. So like for instance, let's look at this one right here, E10.3211. Type 1 diabetes mellitus with mild non-proliferative diabetic retinopathy with macular edema, right eye. We don't need to code anything else because that includes everything that's going on. But again, as you notice, we'll go down. We have retinopathy issues. We're also, as we continue to go down, macular degeneration is another big problem. We're also going to see, again, neurological conditions, circulatory complications, arthropathy, skin conditions, oral complications. But right here, all the way at the end of the code category is E10.9, which is type 1 diabetes mellitus without complications. So here's where it can get a little complicated. So we're going to go to the ICD-10 index, okay? We're going to go under D for diabetes. We're going to follow it down pretending like this is our book. So here we go, diabetes, diabetic. So see how it says E11.9 right there. Remember, and I love these pop-ups, okay? This is type 2 diabetes mellitus without complications. If the doctor just writes diabetes or DM or DM2, that's E11.9 because they're saying the patient has diabetes with no complications. But if we click on this and we're looking at it under our book, we'd have to go, so we have to go down to, so due to drugs or chemicals, we got to go all the way past that. We got to keep going. Type 1, and then next to type 1, the code, the automatic code right there is the uncomplicated. Okay, same thing when we scroll down to the type 2, right there. Okay, so that's something to keep in mind. Okay, remember these codes that are directly next to the main term are the most common, and in this case, they're the most common because they are the uncomplicated diabetes. So always remember, always start in your alphabetical with diabetes and end in the tabular, and make sure to always look at the code category notations because that's where they're going to say. So again, if we go to E11.9, this is without complications. But if we, But if we start at the beginning of E11, again, there's an use additional notes for our drugs. There's an excludes notes for the other types of diabetes. Then the includes notes. Now, this website has a lot of clinical information, which you have in your ICD-10 book usually. And then again, it starts, but here it goes. This is going to go through all the complications until we get all the way to the E11.9, diabetes mellitus without complications. When it comes to the other endocrine, nutritional, and metabolic disorders, again, always double check the category to see, because a lot of these conditions counteract with our neoplasms and with other body systems. All right, guys. So always remember, start with diabetes. Make sure you get the correct type when you're looking for it, with or without complications. And always remember, the code that sits directly next to the type is going to be the without complications.